Hi, my name is Frank Avalis, and today we're going to talk about something that often gets missed. How can you tell if your patient has lymphedema, especially if you don't have access to imaging or lymphoscintigraphy? So let's define lymphedema. It is a chronic disease, it's progressive, and it's a damage or dysfunction of the lymphatic system. And so often you can identify it based on a good clinical history and also looking at signs. So let's talk about what the signs are. Number one, asymmetric swelling. Usually one leg is going to be bigger than the other, or an arm. It could be bilateral, but still one leg, one thigh, one lower leg is going to be bigger than the other. If it's bilateral symmetrical, then you may be looking at something more systemic. Now, this progressive stages, usually in the beginning, clinically you may not be able to see a difference in size, but the patient often describes the limb as being feeling achy, heavy, tight, not painful like an injury. Then you can also look at a stemmer sign. This is when you take your finger and also your thumb and you pinch the skin right above the second toe or the second finger. If you can't pinch the skin, it's positive. Not pitting edema. So early on, the patient may have pitting edema, but as fibrosis sets in, creates an inflammatory storm, then the skin becomes a little more fibrotic and it won't pit. Skin changes. Look for hyperkeratosis, a wound, an infection. Elevation will not relieve it like it will in chronic venous insufficiency. A good patient history will tell you. As you can see in this chart, there's primary or secondary lymphedema, but look for a history of cancer, radiation, chronic infections, or patients do have chronic infections, and also history of trauma and burns. This is a gradual onset. It doesn't just happen overnight. It happens over time, which that leads us to the stages, 0, 1, 2, 3. 0, you won't be able to tell, but there's an insult. Patient feels heavy arm, heavy leg. Stage 1, the swelling disappears after you go to sleep. When you wake up next morning, it's gone. Stage 2, you wake up the next morning and the edema's there. It's not going away. And stage 3, there's changes in the skin, and that's because of fibrosis. Make sure you also code it correctly because this helps take care of the patient. There's a lot of products that are only covered if it's diagnosed correctly. And so if you do have a patient with lymphedema, asymmetrical swelling, ICD-10 I-89 is one of the few diagnostic codes. Now, keep in mind, lymphedema is under-recognized and under-coded, but with a good eye and focused history, you can make a big impact in your patients. And keep in mind that most of patients we see in wound care clinic have CVI, which by the 2020 study, now we know that CVI can lead to lymphedema, as you can see in these pictures. Make sure that you identify it and refer it properly. So keep in mind, subscribe to the Frank and Lissy Show. We're on YouTube, LinkedIn, Facebook, and Instagram. Thank you.